Occupational health and safety. Occupational health is an area of work in the public health to promote and maintain the highest degree of physical, mental, and social well-being of the workers in all occupation. That is the target of occupational health, and that is the definition of the occupational health according to WHO. Its objectives are the maintenance and promotions of workers' health and working capacity, to check that all the workers are in their optimum health to perform the job described to them. Improvement of working condition and the working environment to become conducive to safety and health of the workers, so that the working conditions and the working environment where the employees are posted, it is safe for their health. The development of work organization and working cultures that should reflect essential value systems adopted. The or every organization have their own culture, working culture, and that should reflect the essential healthcare values, which the OSHA has mentioned in the definition. So healthcare workers face a wide range of occupational hazards on job, including the first and the foremost is needle stick injury, then musculoskeletal pain related because of long standing during a surgical procedure or any critical care procedures, etc. Work related illness, transmission of infection, others like emotional stress or facing violence from patient visitors, etc. Stress and overwork, respirable infectious disease. So these are some examples of healthcare associated in occupational hazards. So bloodborne pathogens. There are three main bloodborne pathogens: hepatitis B virus, hepatitis C, and HIV, human immunodeficiency virus. So these are the three bloodborne pathogens, which is a occupational hazard in the healthcare industry. So if at all you have exposed, or a staff or someone has been exposed to hepatitis B virus. So what is the prophylaxis for that? What should be done? So first you have to send for the hepatitis B surface antigen test. Okay, HBsAg means hepatitis B surface antigen test. So if the result is positive and the patient or the staff or any responder he is unvaccinated, it is known that he or she is unvaccinated, start the vaccination immediately if the test is positive. And if the test is negative and still the patient or the person here, person exposed is unvaccinated, you have to still start the vaccination. Okay, so if unvaccinated people are exposed to hepatitis B, whatever may be the result of the test, vaccination should be given. In vaccinated responder, the person who is vaccinated, if the hepatitis B surface antibody, here it is antibody in their blood, is less than 10 international unit per ml, okay, and the test has came back positive, no treatment should be given. But if the test has come back negative, again no treatment has to be given. They have adequate antibodies in their bloodstream, so you don't have to vaccinate them. But if in a vaccinated non-responder, antibody is less than 10 international unit per ml, so you have to start the revaccination. The second dose of vaccination should be given. And if the test is negative with such less amount of antibodies, no treatment has to be given. So what will you do when you have to follow the post exposure prophylaxis for HIV? In case of HIV, if it is a solid needle, a superficial injury, or a small volume of splash, okay, and the HIV is negative, no post exposure prophylaxis is required. No treatment has to be given if the test is negative. But if the HIV test has been positive, if the person exposed is asymptomatic, viral load is less than 1500 copies per ml, triple therapy has to be started. For example, zidovudin and other two antiretroviral drugs. The cocktail of three anti-HIV drug is called triple therapy. It has to be started. If the person exposed is symptomatic with very high viral load and has and also begun AIDS and acute serocron conversion is going on in their bloodstream. Okay, triple therapy has to be started. If injury factor is because of large bore or hollow needle, deep puncture took place, visible blood on the device was there, needle used in intravascular puncture had caused the injury, or there was a large volume blood splash, and still the negative. If the result is negative, no PEP is indicated. If HIV is positive, again in both the cases, asymptomatic or symptomatic, triple therapy has to be given. If the one takeaway from this slide is, if it is negative, nothing has to be done. If it is positive, the test has come back positive. In any cases, if even if it is symptomatic or asymptomatic, triple therapy, the cocktail of anti-HIV drugs should be started. Next is post-exposure prophylaxis for some other diseases, for example, measles and varicella. If action taken is to be within 72 hours, measles vaccine has to be taken after the exposure, or if you are late by 72 hours, immunoglobulin vaccination can be taken within 6 days for high risk patients. Varicella vaccine should be given within 120 hours. If delayed after exposure, immunoglobulin can be given within 96 hours for high risk patient. In case of tuberculosis, report to the infection control practitioner or staff health nurse depending upon the hospital protocols. And meningococcal meningitis, provide chemo prophylaxis with ciprofloxacin if exposed to meningococcal meningitis. Needle stick injury, these are the demographics of needle stick injury. The wounds are caused by needles that accidentally puncture the skin. That is called needle stick injury. So 30% of the needle stick injury arise while inserting a IV cannula. So staff nurses should take special care in this procedure. 21%, the second highest rate comes from handling garbage bags. So waste handlers are at risk. Next is during dusting through the blood sugar needle, while handling suture needles, subcutaneous injection, while recapping, and while withdrawal of blood. So these are the various factors which may lead to needle stick injury if proper care is not taken. So needle stick injury among the healthcare workers, you can see 44% of needle stick injury. Nurses are at the most risk from needle stick injury. Second at risk is the other staffs like waste handlers and everyone. Then junior medical doctors, student nurses, dental clinic staffs, etc. So these are the demography of needle stick injury. So what happens after a needle stick injury? So for you, like what you should put into practice, what policies or protocols you should follow to prevent needle stick injury. One needle, one syringe, and only one time. That is safe injection practices, coalition. Okay. Follow proper infection control practice, aseptic technique during the preparation and administration of injected medication. Example, perform hand hygiene, etc. Never administer medicines from the same syringe to more than one patient. One needle, one syringe, one time, and one patient, even if the needle is changed. Never enter a vial with a used syringe or a needle. Do not use medications packed as single dose or single use for more than one patient. If it is a single dose medication, the entire single dose should be administered to the patient. Or if a dose has to be reduce the dose and you have to throw the remaining, but do not reuse it. Do not use bags of intravenous solution as a common source for supply for more than one patient. Limit the use of multi-dose vials and dedicate them to single patient whenever possible. Always use face masks while injecting any medications into the catheter or into the epidural or subdural space. After needle stick injury, what is the procedure? Stop the procedure immediately. Wash the wound with soap and water. Encourage bleeding and apply antiseptic. You have to press the area which have the wound and make sure that maximum blood oozes out. Immediately report to the nodal officer in the casualty for first aid and emergency treatment or any other follow-up action. PEP is provided in the casualty around the clock. Whenever you come across a needle stick injury, run to stop the procedure wash your hands with soap and water, ooze out the maximum blood, directly go to the casualty, and from there, nodal officer and everyone can be reported. Post exposure prophylaxis kit are available in the casualty. Retention of the items if possible. If you have not through the needle which has injured you, if it is with you, it is best to bring it with you so that it can be sent to the laboratory for test. Investigation, determination, and implementation of remedial measures according to the test which comes back. Record and document the injury.